I'm Dr. Mark Block. I'm one of the directors of Holsworth House Medical Practice. We're a high HIV caseload GP practice in inner city Sydney. Once you've diagnosed a person with HIV, the important principles are providing access to effective clinical management for them, and that includes the option of commencing antiretroviral therapy, providing psychosocial support and counselling, providing support in terms of information about the potential transmission of HIV and preventing transmission to others, and in terms of contact tracing, to contact people who may have been at risk of exposure to HIV through contact with the new patient, and also to link up with specialist support services that are widely available in New South Wales to assist in management of HIV. So the management of HIV can be a situation where you can refer a patient to a specialised service, or you can co-manage the patient with a specialised service. There are different models for managing patients with HIV. And there are different facilities for managing patients with HIV. So some patients are managed within a tertiary hospital situation. Others are managed in sexual health clinics. Some are managed in high HIV caseload clinics. There is a program through ASHM, which is the S100 prescriber program, where practitioners who are interested in managing patients with HIV can do a course and basically learn and become qualified to prescribe HIV through the S100 program. Some patients are co-managed. In other words, some of their care is managed within private practice or a clinic, and that management is shared with a tertiary hospital institution. That can happen particularly in patients who are fairly complicated or fairly advanced with their HIV. There can be situations where a doctor might have few HIV patients, and there might have a shared care situation where the hospital or specialist clinic would initiate therapy, and the GP would then write further scripts for the patient and manage them, and perhaps share some of the consultations with the hospital specialist clinic. Well, at the moment, the access to treatment is through generally a hospital outpatient pharmacy or sexual health pharmacy. This will change where dispensing will be through some nominated general pharmacies as well. There's often some difficulties for patients and practitioners who are located in more remote areas. Some patients may feel very concerned about confidentiality, and also there's the issue of access to the medication. The treatment really needs to fit within their daily routine and daily lifestyle. Some of the treatments have provisions in terms of whether they can be taken with or without food, and it's the number of pills in total and the dosing, how many times a day. It's a discussion that you can give a patient different options and work out with them. And also some particular drugs have particular toxicities, or they might have some interactions with other treatment that the patient might be taking. So those all need to be taken into account to sit down with the patient and work out what is going to be the best treatment for them.